Marion Diamhachi is a resident of Mutungo Bina in Kampala. 3 years ago, she gave birth to her first son, Regan Kamkama. From the time he was born, Kamkama had been a sickly baby, and this prompted Diamhachi to seek medical help from Mulago Referral Hospital in January this year. After a series of tests, it was discovered that Kamkama had a hole in his heart, which is likely to cause him heart failure. She was asked to solicit more than 18 million shillings for her son's operation, an amount she couldn't trace. Diamhachi says that every penny she gets goes on Kamkama's treatment, to the extent that she can no longer pay for rent. She even once contemplated suicide. When we communicated with her some time later, Kamkama had collapsed and was rushed to hospital. He is now on life support. People like Diamhachi live in a world where access to specialized health care is all but impossible. However, it is not only the poorer members of society that have no hope of accessing specialized care in their own country. On Wednesday, the State Minister for Primary Health Care, Dr. Joyce Moriku Kaduchu, was airlifted to Kenya's capital, Nairobi, when she failed to get the right treatment locally after she suffered a serious suspected case of food poisoning. Her senior counterpart, Jane Acheng, the Minister of Health, is also currently in India for a surgery. The cases of Ministers Moriku and Acheng have highlighted how even those charged with ensuring the provision of quality health care for Ugandans cannot depend on the local health care system to take care of them.
The same person now has run away to seek medical attention elsewhere. So what happens to the plight of Ugandans? It is sad. It is important that Ugandans rise to the occasion of challenging some of these injustices.
It is possible the ministers did not trust the doctors to provide care, okay? But not that the doctors do not have the skill. They did not trust the system.
Julius Kapwepwe, the program's director in Uganda Date Network, says that the research conducted by their organization indicates that government spends over 12 billion shillings on VIP treatment abroad.
From December now, 2017, to the last 3 years, Uganda has so far spent about 12 billion on government officials and related VIPs. But that money alone now would be able to fix over 12 hospitals.
According to Dr. Ekwaro Buku, the president of the Uganda Medical Association, Uganda is endowed with specialized doctors who only lack equipment.
We've got very highly trained personnel, doctors, nurses, pharmacists, etc., and are only limited by absence of what to work with, equipment, drugs.
They want the country's health policies to be changed.
If by law the president is required to seek health care from Mulago Hospital, for example, or Entebbe Hospital, for example, then you will find that inevitably the attention given to the public health system will change. The money going to roads will find itself going to the health sector.
We are unable to get a comment from the government spokesperson about the matter. Solomon Kawesa, NTV.